Hi, it's Dr. Alexis Parker from Laser Aesthetic Health, and welcome to Facebook Live. Tonight, I have Jesse here, and we're doing his second Agnes treatment. His first was 2 months ago. We're seeing some early changes, and we're going to go treat again. He has told me that his experience with Agnes was better than his experience with Kybella, and better than his experience with Cool Sculpting. So just in case you want to remove some fat from under your jawline, just know that there are several options, and you can discuss those options with me or whoever your provider is. And also tonight, if you have questions about Agnes, obviously if you've watched Facebook Live before, you've seen us use it for inflammatory acne, cystic acne, wrinkles, fat pads under the eyes. We've even done some fat pads above the eyes. We're seeing great results, so we'll be posting those on our website and on Facebook as we process them. We're still in the early stages of using this device, but are really learning to love it. So I have already anesthetized this area. You can see I've gone from the lower jawline. I don't want to do anything up here above the mandible, because he's young, and I want to keep as much soft tissue as possible over this bone. But we're going to start right under the bone and treat to the midline. Earlier today, we did this side of the face. You can see that, I hope you can see this, that there's really very little swelling, there's no bruising. Some of these bumps were beard bumps from shaving. And
all those bumps are beard bumps.
All those bumps are beard bumps from shaving.
Yeah.
He has very coarse hair, and
he didn't use shaving.
He told me he didn't use shaving cream. So here we have some beard bumps that are. You can see the beard bumps on the skin. This is not from the Agnes treatment, but the white is from the lidocaine with epinephrine. So we're going to get started. He's done it before, so he's going to give me good feedback. First of all, I'm going to see if he's numb enough. Do you feel this?
Yeah.
So it's not sharp. He made you feel pressure?
A little.
He feels a little pressure, and we would expect that. So we did 400 pulses on the right side, so we're going to do the same thing tonight. We won't bore you with all 400, so send your questions in right away if you have them, and I'll interrupt the procedure to answer your questions.
And if you see this post later, please still ask your questions, because Dr. Parker will answer them.
Yes, yeah, obviously if you watch it later. And also, also we have a YouTube channel with lots of videos, and we're starting to get up a few videos about the Agnes. So Aunt Agnes is going to work again here on Thursday night. Here we go. I'm going to give the skin a little pinch.
I'm going to zoom on my face.
And I'm going to inject the needles. Very tough skin. And deliver the pulses. Big pinch. Stick. I don't hear any fat crackling. Do you hear the bacon cooking yet, Jesse? I know why.
Oh.
We don't have bacon because we don't have a monopolar ground pad. There we go. I usually put that on the pillow. Jesse got himself on the pillow tonight, so we didn't get that on. So here we go. Now we'll hear a little bit of crackling. Is that comfortable now? There we go. Okay, is that good?
It's good. Oh wait, it's on you now.
We don't want it on me.
There we go. Oh, come on.
Technical delay. Okay? Now, if you can hear this, I'm sure Jesse could hear that. But it's just a little tiny crackle. Obviously not like bacon popping, but a little crackle. You doing okay?
Mm-hmm.
Fat's a little thicker here, getting through the skin a little bit more easily. And I'm right at the edge of the mandible, so I'm going to stop there. And I'm looking at every pulse to make sure that my needles are fully inserted. I checked my needles before we started to make sure that they were nice and sharp and straight and that the Teflon coating was in place. This is the Agnes for jawline fat. How are you doing? Would you like to tell our viewers what you're feeling, if anything?
So I'm feeling a kind of pressure when the needle goes in and when she squeezes my neck. I feel a little heat sometimes, but I feel, or I hear a sizzling sound on most of the pulses, if not all of them. And that's, from what I understand, is the radio frequency going to work on destroying my fat.
We're in process of making Jessie look like an Italian model.
So for those people coming to the October 25th Laser Aesthetic Health Educational event here at the office, we will be showing the picture of the model from Italy, me standing in her profile to said advertising model, and what we've done since then with the Agnes and with fillers. And we've used Botox on my mandibles.
Oop, don't touch.
Botox on my mandibles. Somewhere in my mandibles.
On his masseters.
Masseters.
To knock down the masseters so he doesn't grind his teeth quite as hard.
Botox on my masseters. We've done a little filler in my chin. And we've reinflated my Cupid's bow, i.e. my upper lip.
Reinflated, yes.
Yeah, that's the proper, maybe not the proper word, but it's my opinion. Reinflated.
Dr. Kent Remming calls it reflation.
Aha, sweet. I'm as good as one of the most experienced doctors in the field in my terminology. Okay, so according to Dr. Kent Remington, or me, it is reinflation.
Reflation.
Reflation, okay.
The opposite of deflation.
Well, that makes sense. So we reinflated my upper lip, my Cupid's bow, and we reinflated my lower lip as well. Which, the nice thing about reinflating said lips is it makes you more kissable. And when someone says, ooh, you have sexy full lips, you're like, oh yes, yes I do.
The interesting thing about hyaluronic acids, and in terms of kind of his makeover, is that hyaluronic acids over time really do remodel the face. We've already seen the results of remodeling his nose when we took his photos today. Again, we'll be posting those. It's very interesting how, and he's young, so these changes in his face, changing his genetics a little bit, just to make him a little bit more attractive, will be very long lasting. It's wonderful that we can do these things now without surgery. Okay, I'm going to go in a different direction here. Now we're going to come across here. We want to be right at 90 degrees, and sometimes it's hard to pinch the skin. There we go. And sometimes we have to just stretch the skin. Aunt Agnes hasn't been with us for just a mere, what, about 6 weeks?
Mm-hmm.
So we're still sorting out the best techniques for treatment in my hands.
And you're helping advance protocols too, right, Dr. Berger?
Yes, we're hoping to advance some of the protocols. So I'm going to do another, I've done 156 pulses. We have another 250 to go to finish his neck. But when we finish, it will look like this. He has some swelling. There's a little bit of induration, or you can feel the fullness in the neck. He's going to ice tonight. After I finish, I'm going to apply some healing cream, so he has very rapid healing. He'll send me a selfie every day so that I can follow him, make sure that everything's resolving, but I don't expect any bruising, and I expect a little bit of swelling, but not as noticeable as some of the techniques I've used in the past. So thank you all for watching Facebook Live tonight. This is the Agnes for submandibular or for chin fat.